Are you wondering what a gingivectomy is? Have you been recommended a gingivectomy lately? I'm Dr. Rachel Miro, and I'm a dentist at Dental Implant and Aesthetic Specialists. And today we're going to talk about what a gingivectomy is and why you might need one. A gingivectomy is a procedure aimed at either reshaping or removing excess gum tissue. Most commonly, this procedure is done to improve either the health or the aesthetics of your gums and your teeth. You might be wondering what types of patients need gingivectomies and when are they recommended? Gingivectomies are a lot of times used for patients who have excessive gum tissue. That means gum tissue that has maybe overgrown your teeth. It's also known as gingival hyperplasia. Other reasons why we do gingivectomies on patients are because they have deep pockets. These pockets of gum tissue can overgrow and make it difficult for our patients to clean the area. And then lastly, a lot of times gingivectomies are for cosmetic reasons. A lot of times patients have what we call a gummy smile, which is basically a smile where you see a lot of tissue and not as much teeth. These are really the main indicating factors for gingivectomies. This all being said, there's a lot of benefits to patients getting gingivectomies, one of them being really improving your oral health, making it easier for you to clean those areas that before you couldn't get to. Other benefits are just making you happier with your smile. Our goal as dentists is to make sure that our patients are happy and confident when they smile. And a lot of times gingivectomies are needed in order to ensure our patients are happy with their smile. Here at Dental Implant and Aesthetic Specialists, the most common equipment that we use in order to remove gum tissue is a laser. Lasers have really been a defining technology when it comes to gingivectomies. One, because they really reduce the healing period of that tissue getting back to normal. They also make the procedure quick and painless for patients. You might be wondering, what exactly does the gingivectomy procedure look like? What happens when I get to the office? Is it painful afterwards? It's pretty simple. First, you come in and you see your dentist for an evaluation, and they'll basically decide whether you are a candidate for a gingivectomy. If you are a candidate, then they'll go ahead and get you ready for the procedure. Before the procedure begins, the doctor will administer local anesthetic. This is anesthetic that is given right to the area where the gingivectomy is going to take place. This assures that throughout the entire procedure, you don't feel anything. After this, the gum tissue removal process will begin. The dentist will go ahead and remove whatever excess tissue you have. You will be given post-operative instructions. The dentist will go through what you need in order to properly care for the area. You're going to be sensitive for a couple of days. A lot of times I like to tell patients it feels a little bit like a pizza burn if you've ever had one, because that really is what it feels like. When it comes to pain, if patients are concerned, usually something like ibuprofen or Tylenol will be just fine to take care of that discomfort you might have. Other than that, we might give you a mouthwash in order to assure that you're keeping the area nice and clean. Sometimes, depending on the extent of the removal of gum tissue, you might have a little suture in the area. If that is needed, you will have to see your doctor 2 weeks later in order for them to remove it. Recovery from a gingivectomy is relatively quick, and usually patients can safely go about their normal day after the procedure. If you've been told you need a gingivectomy, or maybe you do have a gummy smile that you're not confident when you're smiling, feel free to reach out to us at Dental Implant and Aesthetic Specialists. We're here to help you and make sure you get that smile that you deserve. I'm Dr. Rachel Miro, and I'm here to help you watch your mouth. Now I need to think about how I'm going to answer that question.